Welcome. I want to welcome everyone who has joined us here in person at Jackson State University's beautiful Student Center and all of those who are tuning in online. My name is Paul Kuttner. I am the Director of Partnerships for Community Campus Partnerships for Health, and I am beyond honored to be your moderator for today's event, and I am humbled by the exciting, important work that will be presented here today. I want to start by thanking Jackson State University for hosting us today. Jackson State, under one name or another, has been educating Black leaders, professionals, and scholars since 1877. What began as a religious school with just 20 students, not long removed from slavery, now boasts a diverse body of almost 9,000 enrolled students, a deep research portfolio, and almost 100 undergraduate, master's, specialist, and doctoral degrees. Importantly, as we will see today, it maintains its link to the long history of knowledge building, leadership, and freedom. Also, I want to thank our partners from Coahoma Community College, whose work will be presented here today. Coahoma was the first HBCU in Mississippi to become part of the state system of junior colleges. Coahoma is celebrating 75 years of providing accessible, diverse, quality, equitable educational opportunities and serving as a catalyst for community and economic development. The title of today's event is From Data to Equity. This phrase points to the essential role that research can play in our collective struggle to ensure that every family and every community has the opportunity to experience health and well-being. But the path from data to equity does not just happen. It takes intentionality every step of the way. It takes the creative and committed work of researchers, administrators, activists, and community-based organizations, government agencies, and educational institutions like Jackson State and Coahoma that are rooted deeply in the communities that are most directly impacted by systemic disparities. You're going to hear a lot today about opportunities, specifically the opportunities offered by the National Institute of Health's All of Us research program, which has built one of the most diverse, accessible, comprehensive databases of its kind. But an opportunity only matters if someone takes it. You'll meet some folks today who have taken advantage of this new opportunity to move research and teaching forward, and you will hear about ways that you can get involved in this important. So I want to begin by going over our agenda for today. We could pull up the agenda slides. So to begin with today, we are going to hear some remarks from Dr. Kareem Watson, the Chief Engagement Officer of the All of Us Research Program, who will be joining us virtually today for a welcome from all of us. Then we will hear a bit about the All of Us Researcher Academy, which is an amazing resource that's being led by RTI International, and we'll learn about the opportunities for training and peer support and technical assistance that you can access through the Academy. Then we're going to hear our first research presentation, and we'll get a sense of the kind of research that you can do and the kind of important findings you can achieve using this data. Then we'll hear from our partners at DREF with their program Research Matters for All of Us, who will talk about their collaborations with Jackson State University and other HBCUs. And then we'll hear a second presentation on research using the All of Us database, looking at the kind of disparities that we can uncover and identify and begin to address through this data. Then we'll have a special panel discussion where we're actually going to hear from 5 students and faculty who are going to talk a bit about what it's like to use this data, the actual experience of doing this research. And we wanted to put that forward because we really are inviting all of you who are joining us in person and online to think about how you might connect with all of us and what it might do in your work. Then we will share a few announcements and updates, opportunities for you all. We'll listen to you through our attendee insight survey, get your input on this event and your thoughts and your learnings from the All of Us database, and we'll have some closing remarks. And then for all of those of you who are in person, we can stop by Ballroom B for a lunch that we're offering all of you. Unfortunately, those of you online will just have to think of us while you're eating whatever it is that you decide to eat. Next slide, please. I want to briefly introduce my team. I'm here with Community Campus Partnerships for Health, CCPH. Our mission is to promote health equity and social justice through partnerships between communities and academic institutions. And some of us are here in person today, and some of our team couldn't make it, but this is the team that's been working on the All of Us HBCU Road Tour, which this event is one part of. We've also been to Howard and Tuskegee and Morehouse and Fisk and Meharry, and we are going to continue on to have a couple of more events, which we'll tell you, we'll keep you in the loop about as the spring and summer progresses. Next slide, please. I also want to briefly introduce the RTI team. RTI is are the minds behind the All of Us Researcher Academy that you'll learn about, and they have a large team with a lot of amazing skills and backgrounds working on it. We can't introduce them all, but we do want to share the deep roots that many members of the RTI team have as alumni or affiliates of Howard University, Meharry Medical College, North Carolina Central University, Winston-Salem State University, the University of Puerto Rico, University of California, Irvine, Florida International University, and Bunker Hill Community College, all of which are HBCUs or minority serving institutions. So just representing some of the deep commitment and connections that the team brings to this work. Our work on this HBCU Road Tour is a part of the Researcher Academy, so we collaborate very closely with RTI in order to put on these events. Next slide, please. Is initially the Research Triangle Institute, but they generally go by RTI. Not sure why that happened. Very strange thing that happened to that slide. So now it is my great honor to introduce Dr. Kareem Watson, Chief Engagement Officer of the National Institute of Health's All of Us Research Program. Kareem leads the All of Us Research Program's efforts to foster relationships with participants, communities, researchers, and providers across the United States to help build one of the largest, most diverse health databases of its kind to study health and illness. Prior to joining the NIH, Kareem spent over 15 years as a community-engaged research scientist, with research funding from the NIH addressing cancer prevention and control. Kareem also held administrative roles in leading research and engagement in federally qualified health centers in the Chicagoland area. So welcome, Dr. Watson.
Thank you so much for the welcome. Can you hear me okay? I'm assuming you can hear me okay? Okay. Thank you all so much for the opportunity to say hello and to bring greetings. Greetings from the National Institutes of Health All of Us Research Program. It's indeed my honor and privilege to briefly welcome you today. And I just want to just provide some highlight as to why it's so important for us to be here. When I became the Chief Engagement Officer for the All of Us Research Program, I knew firsthand the importance of engaging historically Black colleges and universities in this work. I knew firsthand the importance of access and awareness and opportunities. And so I was so thankful that when we discussed the opportunity to more intentionally engage HBCUs, one of the first things I did was reach out to RTI and reach out to CCPH, to Al Richmond and the team there, because I knew the commitment that Al and CCPH had in working with HBCUs. And from that initial email and that initial idea, the idea of the Research Academy was born. And it's so important for us to engage historically Black colleges and universities because we understand historically what an important role HBCUs have played in producing leaders in STEM and research. But more importantly, it's also to understand that in terms of data equity, we must have equity across the board. When I think about the accomplishments of the All of Us Research Program, in that we are one of the world's largest and most diverse genomic data sets, that diversity came from intentional community engagement, ensuring that populations who have been historically underrepresented in biomedical research are now represented. That representation happened through intentional engagement. It happened because we engage fairly qualified health centers as our enrollment sites. It happens because enrollment sites such as Morehouse School of Medicine in Atlanta is one of our enrollment sites. It happened because of partnerships with organizations like DREF, the Delta Research Education Foundation, who help to leverage their deep relationships and trust to build trust with us, with community partners. So I'm so thankful for that work. I'm also thankful because we understand that not only is it important to have a diverse participant pool for diverse data so we can better understand how to develop interventions and preventions and screening modalities that are truly generalizable to populations, but it's also important to have researchers who reflect the population that are driving those discoveries. I know firsthand the importance of what getting access to data can do, how it can spark a career and change a career. So I'm so happy that we're doing these roadshows with RTI and with CCPH and with our partners at DREF and others. And so I thank you all for this opportunity today. Good luck with the data. Please utilize the data to interrogate it, to answer questions that you've never been able to answer before, because that is what truly is going to allow us to drive precision medicine forward for all. Thank you so much and have an amazing rest of the day.
So now we'll have the chance to learn a bit more about the All of Us Research Program and the All of Us Researcher Academy, an incredible opportunity led by the folks at RTI, which offers training, technical support, and peer-to-peer learning to researchers at institutions like HBCUs that have a documented historical commitment to underrepresented students. Presenting on the Academy today, we are fortunate to have Dr. Sula Hood. Dr. Hood is a senior research scientist in the Center for Communication and Engagement Research at RTI International. She is a co-investigator on RTI's Engagement and Retention Innovator Award for the NIH All of Us Research Program. Dr. Hood serves as co-lead for the All of Us Researcher Academy, a program designed to promote equitable access to and utilization of the All of Us Researcher workbench by a diverse array of researchers. Welcome, Dr. Hood.
Thank you so much for that warm welcome, Paul. As Paul mentioned, I am a co-lead for the All of Us Researcher Academy. It is a program that is absolutely near and dear to my heart, and I've enjoyed working with our team and partnering with HBCU faculty, students, and leadership over the past several years. So I'm just going to provide a little bit of background about the Researcher Academy, as well as discuss some of our program components that we invite you to partner in. Okay. So the All of Us Researcher Academy, just for context, is a program that provides training and technical assistance for researchers that are working with the All of Us Researcher Workbench. And the Researcher Workbench is a cloud-based platform that houses the All of Us data that researchers work with. We do have an emphasis on supporting institutions with a documented historical mission or commitment to training underrepresented students, such as HBCUs. We have our QR code here, as well as a link. We encourage and invite you to please visit our website to learn more information about our Researcher Academy, as well as to stay up to date on our Academy offerings, such as courses, signing up for our newsletter. Next slide, please. Okay. So the goal of the Researcher Academy really is to establish a diverse learning network of researchers to be able to connect them to All of Us data. We want to really ensure that access to and utilization of the Researcher Workbench is equitable and accessible to a wide range of researchers from different backgrounds, as well as different institution types, as well as different levels in their education journey. Our program objectives are focused on raising awareness about the All of Us Research Program and the Researcher Workbench, creating internships and fellowships and experiential learning opportunities, creating a curriculum to help train and inform people and equip them with the various different skills that they need to analyze the data. Also providing technical assistance through our team of Researcher Workbench coaches, as well as building and leveraging partnerships to be able to connect with diverse researchers. And finally, we conduct rigorous evaluations to learn about our program implementation, as well as our outcomes and our impact to inform our continuous delivery of the program. Next slide, please. So I'm going to talk a little bit about some of our various different program components. One aspect of our program is our offering of tuition-free short courses, and these are accessible and free of charge to researchers at HBCUs, for example. And our course offering, we've tried to take a very comprehensive approach. And so we offer courses on an introduction to the researcher workbench, around designing studies, analyzing data, all the way to moving toward disseminating data, applying for NIH we also have a course on library science to connect faculty to learn about how to conduct literature searches to support all of us analyses. And one point I'd love to make about this, as we've have developed and staffed our courses and our various different program components, we've also been very intentional about engaging instructors for our various courses that are either HBCU alum or have affiliations with HBCUs. And we thought this is very important for instructors to understand or have lived experience regarding the institutional context of the course attendees. Next slide, please. Okay. Another one of our components that we're really excited about is our Institutional Champion Award program. And this is a mechanism that supports teams to be able to conduct research with the All of Us program data set. Through this mechanism, teams are awarded funding of up to $75,000 to support teams that are comprised of faculty members, students, or postdocs, and these are 1 year in length. We encourage the composition of interdisciplinary teams, and so many of our teams have included both health and social science researchers, which is reflective of the diverse types of data that is available in the All of Us data set. To date, we have funded 3 groups of institutional champion awardees between 2022 and 2024, and our first 2 institutional champion groups consisted of HBCU investigators and teams. Next slide, please. So now I also am going to talk a little bit about our Researcher Academy internship program. And this is an opportunity to provide students to get hands-on experience working with the All of Us data set. Through this opportunity, students are paired with a primary mentor that is a person who has active research with the All of Us researcher workbench. And they also have a co-mentor, which is one of our researcher workbench coaches. These internships are conducted virtually or in person, and they are 4 months in length. At the conclusion of the internship, we ask that students submit an abstract for possible inclusion in the All of Us researchers convention. And they also receive a certificate that acknowledges their participation in our internship program, as well as they are featured in our Connections newsletter that I'll tell you about here shortly. Last year was our initial year of hosting the internship, and we had 6 internships. I do want to announce that we are currently accepting applications for this year's internship until midnight on this Friday, which is April 26th, and that is midnight Eastern time, so 11:59 p.m. Eastern time. encourage and invite you to scan the QR code to get more information about the internship. If you're a student and you're there at Jackson State or joining online, certainly encourage you to apply if you're eligible and interested, as well as for faculty members or leaders that may be on the line. If you would share the opportunity with students that you know who might be eligible, that'll be great. Thank you. Next slide. Okay. And I also just want to talk about our Researcher Academy newsletter. This is where we pour a lot of love into highlighting all of the great accomplishments of our various different members that are connected with the Researcher Academy. To date, we have over 500 subscribers, and it's growing. We have the QR code here at the bottom, and invite you to sign up for our newsletter. We have various different sections within this newsletter, including a researcher spotlight section where we have featured information about faculty members or accomplishments of students. We also have a career corner that is led by Miss Frida Green, one of our team members, where she provides career tips. We also include announcements for our Academy upcoming courses and events, as well as feature announcements from our other partners in this section, that section as well. And so there's a lot of great information. And in addition to visiting our website, we encourage you to sign up for the newsletter to stay up to date. And it's provided on a quarterly basis. Next slide. Okay, so now I'm just going to take a few minutes here to talk a little bit more about the All of Us Researcher Workbench, and in terms of what types of data you can analyze and the various different levels of access. Next slide, please. Okay, so as I previously mentioned, the All of Us Researcher Workbench is the cloud-based platform that houses All of Us participant data. And so it's a centralized and very secure platform where data access is offered into 2 tiers. So the registered tier contains individual level data and is available only to approved researchers on the Researcher Workbench. And so it includes data from electronic health records, wearables, survey data, as well as various different physical measurement data. The control tier is more sensitive than the registered tier of data. And so you do have access to the registered tier data, but also within the control tier data set, you have access to genomic data in the form of whole genome sequencing, genotyping arrays, as well as some previously suppressed demographic fields from the electronic health records and surveys. Over to the right, you can see that there's hundreds of thousands of different responses to various different types of data. As I mentioned before, the All of Us data set in particular lends itself to researchers with a wide range of interests and from a wide range of disciplines as well. And so there's over 400,000 survey responses on a range of different types of survey topics. There's physical measurements data, genotyping arrays, electronic health records, whole genome sequencing, as well as long read sequences as well. Next slide, please. Okay. So the data use and registration agreement, or DURA, is very important. And this is an institutional level agreement that allows researchers to access the Researcher Workbench. And so once an institution has completed this agreement, the DURA covers access to individuals that are associated with their particular institution. And this happens by linking the individual's email address to that particular DURA agreement. DURAs provide data access to any US-based academic or healthcare institution or nonprofit organization or government entity. And it's administered by the Data and Research Center, or the DRC, at Vanderbilt Medical Center. And so it's important before you go to sign up for the Researcher Workbench to make sure that your institution has a DURA in place. And so we've included the QR code here so that you can see if your institution has DURA access already. If your institution does not, there's also guidance on that page about how to go about applying for a DURA access. Hey, next slide, please. Okay, so now I'll just briefly talk about the process of registering for the Researcher Workbench. And so it's 4 steps. So the first step is to confirm your institution's agreement to make sure that they have DURA access. Once you've confirmed that your institution does indeed have DURA access, you can create an account and verify your identity. And then the third step is to complete the mandatory training. Everyone who signs up for the Researcher Workbench is required to complete trainings around data use and research ethics, for example. And then the fourth step is to sign the data user code of conduct. And we have our QR code here so that you can go directly to the registration page for registering for the Researcher Workbench. Next slide, please. As you are going through the process of registering for the Researcher Workbench, you'll be asked 2 questions during that process. One is, how did you learn about the Researcher Workbench? We encourage you to select activity, presentation, or event if this is the manner in which you're learning about the Researcher Workbench through this particular road tour today. And then the next question is, did you learn about the Researcher Workbench from any of these specific program partners? RTI is the third partner that is listed, the All of Us Researcher Academy. And so we do ask that if you go through the registration process following learning about the Workbench today, that you follow these steps. Okay. And that concludes my discussion about the Researcher Academy and Researcher Workbench. And we'll be on the line and we'll be happy to answer any questions that you have.
Thank you so much, Dr. Hood. That's a little of the background on the Workbench, on the Academy, on why this is happening, and why we've come together. But I know what many of y'all want to hear today is what it looks like when researchers get their hands in this data. So I'm excited to have our first research presentation from Dr. Stacy Jones. Dr. Jones is currently a chemistry instructor at Jackson State University and an adjunct science instructor at Coahoma Community College, which is where the award originally came for the research that you're about to hear. Originally from the Mississippi Delta, Dr. Jones completed his undergraduate degree in chemistry at the University of Mississippi and pursued his graduate degree at Texas A&M University and at the University of Mississippi before finishing his PhD years later at Jackson State University. He also has a master's in physics from Texas A&M University Commerce. His expertise is in material science and optical spectroscopy, particularly nanoscopic systems and hybrid materials for environmental, pollutant, and cancer detection. He has recently focused on using his background in data analysis to use large data sets like All of Us to study health disparities and the social determinants of health. Welcome to the stage, Dr. Jones.
Thank you, Dr. Kudner, for that kind introduction. So my presentation today will be on the implications of cotton production on respiratory health. Of course, it is an All of Us study. Next slide, please. So here is an outline of my presentation. I'm going to talk a little bit about the background, why we decided to study this research question, what the particular question was, and then we'll go into our approach for analyzing the data, some of the statistical methods that we use, show you the results, and then talk about some preliminary conclusions and some future research topics. So the star of this, of course, is cotton. And one of the things that I want to mention is that cotton is kind of unique in that most crops are harvested either when they reach maturity or they're allowed to die and then harvested. But cotton is actually dosed with the defoliating agent first to remove all the leaves. And it is the leaves are removed and then the bulb of the cotton can be harvested. Next slide, please. So at Coahoma Community College, it serves 5 counties in Mississippi. Those counties provide most of the cotton production in the state of Mississippi. And I also grew up in the Mississippi Delta, so I'm very familiar with cotton production. And the research questions come because of the experiences of people who live in areas where there are cotton production. In cotton production, the defoliating agents are often either A, dosed using crop dusting planes. As a child, I remember experiencing the mist of the defoliating agents falling on me, okay, because they're often dispersed by wind, or either they have these walking contraptions like you see in the second picture that walk over the field to disperse the defoliating agent. Again, that defoliating agent can be dispersed by wind. Okay, so those who live in the environment can experience those defoliating agents. And I recognize that I was exposed to them as a child, and as an adult, I have terrible sinus problems, and also I am affected as a child by childhood asthma. And so the idea was there some type of connection between these two things? Okay. Next slide, please. So there were a few things that we wanted to look at, okay, because of the experience and also because Coahoma being in the Delta, it affects our students. So one, we wanted to see, does it provide worse outcomes, okay? Are there effects on life expectancy that you see because of this type of exposure? Okay. We also want to look at some of the effects of things like socioeconomics and also things like race and gender. And I'm going to talk about mainly the race and gender aspects today based on the results that we have from the All of Us Researcher database. Next slide, please. So I want to talk a little bit about the approach that we have. And this schematic shows you what we did. So we have a large number of participants that are associated with the All of Us database. What we chose to look at is the subset of participants who had problems with their respiratory system. So that included allergy, chronic infections, asthma, etc. So first, we removed only those who experienced those types of problems. Now, we then use information from the USDA to look at which areas have the highest cotton production, okay? And there are about 5 states in the United States that account for about 80% of cotton production. And so we're going to use participants in those 5 states as our experimental group. That's what we're going to call it. Well, you can argue that they may have higher problems not because of the cotton production, but simply because they grow cotton there because it's in this, areas where you have climates where cotton grows well. And those types of climates also have things that bloom well, right? And so those could also be a reason why you see higher incidence of respiratory problems. So we decided to look at a second control group. And the second control group was areas that the USDA said also had cotton production, but not large amounts of cotton production. In other words, there are likely to be areas where the same type of blooming plants and foliage would grow as the cotton producing areas, but they don't have the large production of cotton. So we're going to call that a regional control group. And then finally, we have the group of everybody that was not in the high cotton producing area. And we're just going to call that our general control. So we divided up the full group into those three groups. Now, there were certain things that we noticed there were limitations because of the All of Us database. One is that some of the states where cotton is grown but not in a high percentage are not represented in the database, okay? The other thing is that if there are fewer than 20 participants, they can be easily identified. And so they were grouped together into a fewer than 20 participants state group, okay? But even with that said, we were able to identify a number of states who had low cotton production and also were not in our experimental group. All right, next slide, please. So with the help of all of us coaches, the data coaches, I was able to pull data based on state, okay, and then group that data based on race and also based on gender. And I looked at that for all of the participants, for those in our regional control, in the experimental group, and in the general control. And this is the tabular form of the data. But we as scientists often look at data visually because it's easier to see the type of trends that we're interested in. So we're going to look at this visually. Next slide, please. So here is a representation of graphical data that shows the racial percentages of those in the different groups at the top, okay, and the gender percentages of those in the different groups at the bottom. And so there are several things that become obvious when you look at the data graphically. The first is that in the top group, which represents gender, there is a very different distribution than there is in the control group. Okay? In fact, there is a much higher percentage of African Americans that you see in the group in terms of looking at the race. In the bottom group, what you see is the distribution based on gender. And although the experimental and the regional control groups are very similar, there is a much different distribution in terms of gender in the general control group. So let's look at those differences more specifically. Next slide, please. So if we look at race, in the general control, the ratio of African Americans to white Americans were the same in the regional control, or approximately the same in the regional control and the general control, which implies that even though there are climates that associate more things blooming in the regional control group, that they don't show very much difference in respiratory problems compared to the general control. However, if we look at the experimental group where most of the cotton is actually produced, well, you see two things that are very, very significantly different. Number one, there are more African Americans that report respiratory issues in that group than the other group. Okay? So there are 49% compared to the 45% of white. Okay? And also that there is a much, much larger number. Now, in terms of the gender, we see something that's a bit different, which is that in terms of the gender, what we see is that there seems to be more men that report respiratory problems in both the in both the experimental group and in the regional control compared to the general control. So that's what our data shows. Next slide, please. The preliminary conclusions seem to imply that there seems to be a disparity in the way that those who have different those from different racial groups experience in our experimental group. Okay, so there are more Black respondents from the All of Us data who experience respiratory problems in the areas that have cotton production compared to other areas. And it looks like that's not because of the climate, because we don't see that in the regional control. The other thing that we see is that it seems that in general, in both the experimental group and in the regional control group, that there are more men who experience respiratory problems than there are in the general control. That is, areas where we can't have the type of climates that support crop production. So future research directions that we're interested in is, one, we're also interested in cancer. You may not be aware, but Agent Orange, which is a classical defoliating agent, is also a well-known carcinogen. And so we want to see if we see different or similar types of disparities when we look at incidences of cancer in cotton-producing regions compared to these other groups. The other thing that we want to look at is soybean production, because the counties that are served by Coahoma Community College are also high-producing soybean counties, and that the states that have soybean production are not the same states that have county production high cotton production according to USDA. And so the chemicals that are associated with soybean growth seem to have some effect on metabolic health. And so we want to look at things like our incidences of diabetes, et cetera. Okay. So next slide, please. So I'd like to acknowledge, first of all, the participants for the All of Us program, because without the data that they provided, this study couldn't be possible. I'd like to thank DREF and the All of Us program for providing funding and support. And of course, I'd also like to thank Coahoma Community College and Jackson State University for their support, and you for your attention. Thank you very much.
Thank you. Thank you so much, Dr. Jones. I just want to say, it's clear how vital this research you're doing is, with something as central to the history and economy of the South as cotton, and really digging out these disparities at a broad level. And I'm wondering if you could maybe just take a second to share kind of what was most surprising to you as you dug through this data. What really stood out to you? Is there anything you didn't think you'd find? I'm curious what that was like.
Well, I expected to see racial disparities, but not as big a disparity as I saw. But I was really surprised to see the difference in gender effect in both of the groups in the regions that can grow cotton compared to the general control. So that was a very surprising finding. So there's a gender disparity there that I was not expecting.
Sure. Does anyone else have a question for Dr. Jones who would like to share? And I'll repeat it for those online. Thank you. So the question had to do with growing up in the Delta and fishing and seeing the green in the water, and wondering about whether there was anything in Dr. Jones's research or in the data about pesticides and pollutants to the water.
Oh, thank you for the question. There isn't anything specifically in the All of Us data, but the All of Us data is a great place as a starting point, because in addition to this data, we're also able to look at data from the USDA, for example, and for the Centers for Disease Control. And so we can look at whether the general populations and not just the respondents see the same type of trends. And so we're starting to analyze that data now. So we're looking at those type of things, but this data does show that there appears to be some disparities. And so we're using the generalized data from the federal databases to look into those types of things in more detail.
Thank you very much, Dr. Jones. And we'll be hearing from about another research project soon, but in between, we want to hear from our want to hear from one of our partners. So for this stop on the HBCU road tour, we're actually been collaborating with a sister organization that's been leading its own All of Us initiative, the Delta Research and Educational Foundation, or DREF, as Dr. Jones mentioned, which is founded by the Delta Sigma Theta sorority and supports scholastic achievement, public service programs, and research initiatives focused on African American women. So today we are going to be joined by DREF's HBCU Collegiate Engagement Coordinator, Cynthia Glenn Cotton. Ms. Cotton is a 1985 graduate of Jackson State with a BS in computer science and an MS in computer science from the Illinois Institute of Technology. We've got lots of Jackson State connections today. She's a certified project manager, PMP. She worked at Bell Labs, Nokia, for 30 years as a software developer and technical project manager and release manager prior to retiring and then forming her own technology project management consultant company, which has brought her to work with DREF. So welcome, Ms. Glenn Cotton.
Thank you. Good afternoon to everyone. Good afternoon. I am very proud to be a graduate of the Jackson State University, and it is my pleasure to be here today representing DREF, but also coming full circle from graduating from an HBCU and getting exposed to the many things that led to my ability to have a stable career. So I thank and appreciate Jackson State for that. And so today in my role, I will present to you some of the core things that the Delta Research and Education Foundation has done under the auspices of our grant from the NIH. So next slide, please. And the next slide. So all of this work takes a village. None of this happens without partnerships. And so DREF at its core has the leadership team at DREF itself, but the Research Matters All of Us core team is listed here. So on behalf of our principal investigator and program manager, Cheryl Thomas and Kay Williams Dawson, along with the rest of my peers, is listed here. Brede Key, our Research Matters program assistant, Larminda Davis, the Research Matters Community Engagement Coordinator, Peyton Terrell, our Community Engagement Assistant and Social Media Coordinator, myself, my assistant, DeMarcus Haywood, as well as Dr. Kelly Britton, who I know many of you at Jackson State know and have worked with in our HBCU Researcher Program, and Dr. Mandy Hill for the Researcher Specialist role. And I'll talk a little bit about some of those other programs shortly. Next slide. So how do we do what we do? What are our goals? Our campaign is to create awareness and encourage enrollment. So none of the things that, as Dr. Jones indicated, those things can't be done without awareness and enrolling people to be in the database, to be able to be that data to be pulled. So we definitely encourage awareness and enrollment. We encourage health and wellness to make sure we get the message out about intentional and proactive work to keep yourself or improve your health, keep yourself healthy and improve your health. And we also have the goal is to educate the African American community on these various disparities in health and the fact that this program is underway and how you can help by participating. Next slide. So how do we do what we do? So we've been at this for 5 years at DREF. And so in that 5 years, we've developed a core set of programs that espouse the programmatic goals and activities. So in 2 categories, for community engagement and awareness, and then for research capacity building and support. Under our community engagement and awareness umbrella, the citywide coordinators is that program. And we have 12 cities that we work with to increase community engagement and awareness to research and health and the All of Us program enrollment in general. So those are hardworking members of the organization that put on these programs every month or with a regular periodicity. And so the part that I play is my pleasure to work with 10 HBCUs along with student ambassadors and their faculty advisors. And it is very important for me to work with the students because that is the future, and getting research on top of the mind of the students is a great way to seed this program going forward. So I'll talk a little bit more about the goals and objectives of that shortly. Research capacity building and support comes in two ways. So our Dr. Kelly Britton leads the researcher program that helps provide the organizations, the schools, with capacity building and funding to faculty and student researchers to use the All of Us Researcher Workbench. And then we have our other pillar program was the 22 working group, where there is a group of 28 members of Delta Sigma Theta who are indeed researchers, and they're engaged in increasing capacity at their various institutions using the All of Us Researcher Workbench. So again, 4 key areas of work that the Research Matters for All of Us program team leads. Next slide, please. So I'm going to talk in specifics about the 2 that relate to HBCUs, since we are on the HBC Road Tour. So next slide. So for the RAP cohort program, as I said, there are 10 schools, and you'll see the names here: Bennett, Coahoma Community College, Fayetteville State, Howard, D. Jackson State University, Lincoln University, St. Augustine's University, Tougaloo College, Tuskegee, and Winston-Salem State. Those are the 10 cohort schools that exist in our cohort this year. Next slide. So for the RAP, the Research Accelerates Possibilities program. So we follow the academic year because we are in the academic world versus the citywide coordinators who are year-long, but in having events on periodically throughout the year. So during this academic year, we squeeze in a lot. So our goal is to raise awareness about underrepresented populations in biomedical research, increase the community engagement and enrollment by hosting those RAP sessions, which are focused on various topics in health disparities. So the student ambassador, supported by the faculty advisor, works to get a particular topic, a speaker or activity identified, and encourage the students and the faculty and a surrounding community to participate if possible. We create awareness of the All of Us program through these interactive sessions, and we try to pull in the students to make it fun for the students. So learn while you're doing, having fun activities and tips and tricks to just put this information on top of the mind of the student, but learning at the same time as you're having fun. And at the core, we want to make sure we give any of the communities, the HBC communities, access to complete the enrollment process. Next slide, please. So let me go back for a minute. I want to say that for the HBCU objectives, let me give you the outcomes of some of those objectives. So going back to what Dr. Hood, and she indicated how important the DURA is. That has not escaped us here also at DREF. All of our HBCUs, we are proud to say, have a DURA as well as DREF itself. So understanding the importance of that first platform step, all of the HBCUs in the cohort are DURA registered. And in terms of our outreach in our RAP session activity for the year, we've held about, I want to say 71 RAP sessions. And so by the time we close out, we're closing in April. By the time we close out in April, it would be around 82, 83 sessions that we've had across the various HBCUs in the RAP program. And so our impact and touch has been about 4,600 people collectively as we've rolled these programs out. So kudos to the team for all the work they've done for this academic year. Next slide, please. And so the other HBCU related component of our program is the HBC Research Program, which is led by Dr. Kelly Britton, serving as the research specialist. The schools that you see on this slide have been she's been working with, and they've had programs that have been able to take advantage of the resources and strengthen their program. So next slide, we'll go into a little bit more detail. So the goal of this program is to provide strategies for leveraging the All of Us research program to increase the research leadership and capacity. So integrating the workbench activities into curriculum, student and faculty research funding to build the capacity within the organization. Register and support students and faculty researchers to utilize All of Us researcher workbench, as Dr. Hood indicated and as Dr. Jones illustrated the importance of being able to get into that data. But those steps are to make sure your organization has a DORA and then getting researchers signed up and utilizing the workbench. So Dr. Britton has been very instrumental in working with those schools and other HBCUs to build that capacity. Next slide, please. So those objectives are getting one-on-one support for those institutional liaisons. So each of the HBCUs, as we started out, had a liaison that works with them. So, you know, as Dr. Brown at Winston-Salem State and other HBCUs, there's a one-on-one liaison working with that HBCU to bring about the capacity building that this program espouses. So we want to leverage all of our partnerships to support those researchers and students, create programs that support the researchers and students to use that workbench. Again, the goal is to get researchers in to use the workbench to be able to creatively see what studies can come about and what impacts can come from that, and support the faculty to include the workbench in their curriculum and course assignments. So that work is to integrate in to not only have a program one time, or to make sure that that information is integrated and it can be sustainable and repeatable. Next slide, please. And so some of the results of that this year have been to have these HBCUs participate in the workbench usage. Fayetteville State had a summer intern program, as well as there was a LAMP workshop for faculty at Jackson State. St. Augustine had a summer internship program, and then Tougaloo provided a research training for the Tougaloo College faculty. So again, the goal of this program is to integrate and build the capacity of the organizations to support the very important work of using the research database to do various research projects. Next slide, please. So the program at its core supported the institutional liaison. So there's monthly commitments for that leader to work with the organization and provide individual goals and objectives, and that's a contract that's renewable. So that liaison role is a renewable individual contract. Capacity building, as I said, the researcher workbench, curricular and research at the particular HBCUs. And so there has been training held at Howard, on-site researcher workbench training. There's research funding for the summer for the faculty for using that workbench. And upcoming is a grant ideation and writing workshop that's coming up in the spring. And so we try, through Dr. Britton, trying to get exposure to those resources, national resources for the All of Us workbench training and other resources. So that is, in a nutshell, the HBCU research program. Again, that's led by Dr. Kelly Britton. Now, the other program that I want to add is that our Calling 22 is a group of researchers that are Delta Sigma Theta members and who are doing individual researches in their program, in their organizations. And I want to put out that I put the link in the chat. Their upcoming activity on 4/26 is a lunch and learn on suicide prevention for the Black community. So the link there, you'll be able to find the registration information to participate in that. So again, we have those 4 programmatic areas: the citywide coordinators, the Research Accelerates Possibilities program, we have the HBC Researchers Program, and we have the Calling 22 work group. So those are our core areas of work under DREF Research Matters. Next slide, please. So in summary, you can reach us on any of these social media platforms. And if you have any further questions about any of the programs, you can certainly reach us at researchmatters@deltafoundation.net or scan our code. And it has been my pleasure to come before you as an alumni of Jackson State University, but proud of the work that is being done under the DREF Research Matters umbrella. And that concludes my presentation. Thank you for your time.
Thank you. Thank you, Ms. Glenn Cotton. And I would encourage you also, we've got some lively discussion going on in the chat. I think, Ms. Glenn Cotton, if you want to jump in there, I think there's some questions for you. I know there are some questions for Sula earlier. But we are going to move the program on. We have two pieces left that are very exciting. We have a research presentation, and then we will have our panel, and then we will do some business and get some food. So for the next research presentation, I would like to invite up Dr. Azad Bhuiyan. Dr. Bhuiyan is a professor in the Department of Epidemiology and Biostatistics at Jackson State University College of Health Sciences and holds a part-time faculty position at the University of Medical Center with the School of Nursing. Dr. Bhuiyan began his academic journey earning his medical degree from Sir Salimullah Medical College in Dhaka, Bangladesh in 1996. He pursued further education at Tulane University School of Public Health and Tropical Medicine in New Orleans, Louisiana, obtained his MPH degree in epidemiology and his PhD in public health in 2007. During his time at Tulane, Dr. Bhuiyan participated actively in the Bogalusa Heart Study and utilized this data for conference presentations and manuscript writings. Dr. Bhuiyan has served as the principal investigator or co-investigator on several grant-funded projects and has authored or co-authored numerous peer-reviewed journal articles and contributed to 2 book chapters. He is also trained in health disparity research from the University of Alabama Minority Health and Health Disparities Research Center, Birmingham, Alabama, in 2020, and virtual applied data science training from Howard University in spring 2023. And we're going to hear about several of the projects that Dr. Bhuiyan and his colleagues have been working on. Welcome.
Thank you, Dr. Paul, for your wonderful presentation. Next slide, please. First of all, thank you, all of us research programmers for supporting HBCU JSU researchers in advancing health equity project. And also, it is my honor to share our research program with the community partners and also all of the research participants and programmers. And my title on this project, first title is Prevalence and Disparity of Substance Use Disorder in the All of Us Research Program. And this is from Department of Epidemiology and Biostudies. Next slide. We already know that substance use disorder is a public health problem in the United States and also all over the USA and all over the world. And substance use disorder related to first definition of what is SED. It's a condition in which individual take a substance despite its negative effect. That's what SED means. And according to Substance Abuse and Mental Health Service Administration, around 49 million people aged 12 and older had a substance use disorder in 2021. Substance use disorder is related to suicidal attempts and death by suicide. And also it's a raising concern because it's due to prescription misuse, abuse, and drug overdose mortality. In 2021, it shows that suicide is the 10th leading cause of death in the United States across all age groups. And just recently, there is a report from UK that almost 10,000 deaths occurred in 2020 due to substance use, actually alcohol disorder. And most of the deaths are related to drinking problems and dependency. So that's the report came yesterday, and I just quote it here. Next slide, please. So this study investigates the prevalence and disparity of SUD in the All of Us research program, and including especially focus on ethnicity, race, gender, and age group. Why I choose as All of Us research is if Dr. John, Dr. Paul, and other coordinator mentioned that this is All of Us research is diverse participants, 45% racial ethnic minorities, and 80% underrepresented in biomedical research. Next slide, please. So I already, the previous presenter already mentioned what is All of Us research workbench. So I don't have to go through these things, but it's a big platform. It's a huge database. So it's a lot of people, a lot of investors can use this largest data set. So in this, you have a data on various fields, like they mentioned about the electronic health record data. They also did on genotyping, JAWS analysis, then also survey data, and also Fitbit data, and also the other research participant also. So substance use disorder, next slide, is classified based on various conditions. Actually, I combine all of this condition like alcohol-related disorder, opioid disorders, cannabis disorders, and others. And we use specific ICD-10 code to extract data from electronic health record. And that code is used F10 to F15 for substance use disorder data capturing. Next slide. So setting all of researcher workbench, and for this study, we use the descriptive analysis, and we also use it's called workspace platform. So anybody can use using they have the two options. One, you can build your cohort using tools, and also you can build your own code using SQL language. Next slide. So once you log in Researcher Workbench, you have to first define what you want to do. So like I defined the name of the cohort, substance use disorder project. And once you completed, actually before going this one, I think JSU's agreement is called DORA agreement with all of us research programmer. And also we have the individual participants also go through the research of conduct. So once you complete the research of conduct, you have access to all of such research workbench. And also, once I create a cohort from electronic health record, we found that out of 287,000 who participate in the electronic health record, 53,000 participants have condition with SUD. And out of that, we found that 78% are non-Hispanic participants. And in terms of the race, we can see that 47% having that condition, and 32% are African American. Next slide, please. So in terms of the gender, now it looks like a substance use disorder is around 50% for both male and female. And it is not surprising, though it like last report I found that in UK, this alcohol-related disorder jumped among 50 to 54 age groups. And also it's showing that 1 in 4 United Kingdom Parkinson's women are binge drinkers. And in terms of the age group, we found that the middle age group having that conditions, 44%. Next slide, please. So from this descriptive studies, we found that disparities exist in substance use disorder with higher prevalence among Hispanic communities, white race, and middle age group. And so therefore, we need to increase awareness for providers and also healthcare professionals, public health professionals. And also this study is just to showing that to improve health equity, we need to focus on this particular populations. Next slide, please. So this study is not myself. So we try to include our investigator from our JSU and also from other co-authors from UMC Medical Center and also University of Mississippi, Oxford. And also I include 2 students, is there Dr. Precious Edit and Dr. Kanu. I think Dr. Kanu is in the student panelist. So, and next slide. So definitely acknowledgement, we have to acknowledge our administrator, Dr. Alicia Mosley and Dr. McNeil. Actually, before last spring, I did not know about all of such research. So suddenly I saw the email from Dr. McNeil and she told me whether you will be included in all of this. And then immediately I responded, yeah, I will include, I'll be glad to participate in this all of research. So last 1 year, I was involved with this all of such research. And also in my class, I included, because that's from the draft, to teach all of such research program to JSU students. So last spring and this fall, I teach and they're presented in last spring colloquium. And also they also submitted abstract for APHA. APHA. Next slide. And this is also another project. I got fellowship from AMHEAD, funded by NIH. So this is also, I want to see the disparity, actually hypertrophic cardiomyopathy. So because this is it's a genetic disorder, but it looks like 1 in 500 have that hypertrophic cardiomyopathy. So I want to see the disparity by race and also the other clinical symptoms, procedure, and the clinical outcome. And this is needed big data. And also I include not the workbench builder. So I use the SQL language to go inside, and still I'm working on. It's a big data and it's a lot of variables and using electronic health record data too. Next slide, please. And for this fellowship, I have to include the community stakeholders and Dr. Barton Mohammed. He's a cardiologist and he's from Jackson. So I involved him and also need a mentor for this project. And Dr. James Smith from AMHEAD, she's guiding us to using SQL language and how to use electronic health record data. Next slide, please. And this is the some students presented using all of us workbench. Last spring, they used the data browser and data snapshot. This time, they presented, they submitted a project using workbench, the register tier. So this is just showing you how students are presenting, and they are very excited to present the last spring, and also submitted abstract for APHA conference too. I think that's it. Thank you. And also, if any questions, let me know.
Thank you. Thank you very much, Dr. Bouillon. We do actually have one question. I brought it up so I can get it just right. So one question about your study. Along what timeline were the participants interviewed, and were the responses static, or are they part of a continuing active?
This one in all of research.
Well, the data you use.
Oh, yeah, this one I started last spring. So almost I did a lot of project with this, helping students to write a lot of abstract using different data set, and also I'm using a couple of projects from last spring. Initially it takes a long time to understand the workbench, login. Now still I'm learning using SQL language how to use this data. But some parties who are not good, they can also using it's called the data browser and snapshot. But I think for the students and the faculty, they have access and they can use the workbench to get individual level data. And there is a two kind of tier. There's called register tier and also called the control tier. So I'm using register tier for the substance use disorder project. And for the all of the other project, as it's needed genetic data, so I'm using the control tier. There's a difference between using register tier and the control tier. So I already, Dr. Jones, someone mentioned, if you want to use the control tier, you can get data for the genetic data and also the zip code data also in control tier. But if you want to do other research project, you can go the register tier. So both can have access to both tiers. So, but to get the database, it's a different quantity because control tier need a lot of money for get the data because it's a big data. But register tier, I think anybody can use it.
Thank you very much.
Thank
you. Don't take mine. I'll need those. Thank you.
Thank you.
All right, so what we're going to do now is our panel. This is our last real event before we have a few things some business to take care of. So I'd like to invite our panelists down to the front table, please. So I'll share who some of our panelists are. Today we have Tiffany Hord-Aaron, MA, Assistant Professor of Criminal Justice and Sociology. Tiffany Hord-Aaron is a dedicated educator and researcher with a rich background spanning various academic and professional realms. She holds an MA in sociology with a focus on alcohol and drug counseling alongside a BA in criminology and a BS in criminal justice, all from Jackson State University. And she has a demonstrated commitment to understanding social dynamics and fostering positive change within communities. We're also fortunate to have Dr. Jae-gu Lee, Associate Professor in the School of Social Work here at Jackson State University. Dr. Lee has been teaching at Jackson State University for over 10 years and has developed a series of research interests, including adverse childhood experiences and their long-term impacts on mental health, cyberbullying, and its impact on suicide and substance abuse, and parenting in diverse formats of family. In the last couple of years, she has navigated the All of Us workbench to explore women's mental health and how it differs by gender and race ethnicity. Ihunaya Kanu is a Master's of Public Health student specializing in epidemiology at Jackson State University. After completing her medical degree in medicine and surgery, her passion for research led her to pursue a Master's in Public Health. And she is working as a graduate research assistant with RCMI community engagement, focusing on chronic and infectious diseases and health disparities research. Ms. Kanu has been working under the guidance of Dr. Bouillon with the All of Us research program. Caleb Couthen, LPC, is in his third year working toward his doctorate in clinical psychology at Jackson State University. Currently, he is a licensed professional counselor in private practice. He has worked with clients, mainly children and adolescents, for 7 years. He chose to obtain his doctorate because he saw the need for accurate diagnoses to best progress client treatment. And finally, we have Dr. Kendall Smith, assistant professor in the Department of Psychology, who received her master's in experimental psychology and her PhD in experimental psychology from the University of Southern Mississippi. She is currently in her second year as an assistant professor in the Department of Psychology at Jackson State University and is the director of the Memory, Attention, and Comparative Cognition Lab, which investigates questions pertaining to human and animal cognitive processes. And there's so much more I could say, but I want to get to talking. So thank you all for joining us today for our panel. So we do want to open it up for people online to share your questions, and for people in the room to share questions. We'll probably ask you to actually come down so you can share your question on the microphone. But I will start us off just to ask some sort of broad questions that anyone on the panel can answer. The idea behind this panel is really to dig into like what it's like to use this data as a student, as a faculty member, at different levels of your career. So I want to start off with just, for those of you who've done research before, how would you say the All of Us database differs from other databases you've used? And maybe what are the unique opportunities or affordances that the All of Us database offers? So whoever would like to take that. Thank you. And maybe when you first jump on for your first comment, introduce yourself again real quickly so people know who's who. Right.
Good afternoon. I am Dr. Jaegu Lee from School of Social Work. Last year, I just jumped into the Researcher Academy. Was kind of, I had a question. What was that? So I really had the questions. I have been in research for several years. Pretty much, I collect the data, primary data from the survey or other research method. But it's my first time to look up the really huge, large cloud-based in the data set. Was kind of wow. It's a lot of sample, and with the diverse the variables is the language of the research method that my students don't like. But anyway, it was kind of the great opportunity to look up the different type of the data sources in a survey or in experimenter data. That was great opportunity to look up how these data look like, and then I realized there are many opportunity to use this data set for the future research as a mid-career in the faculty.
Great, thank you. Anyone else like to jump in?
Yeah, I can add to that. I'm Dr. Kendall Smith. And so this is my second year as a principal investigator. And before that, I spent 5 or 6 years as a graduate research assistant too. And in the past, for all my own studies, I typically have collected my own primary data. So this is the first time working with a database. And it's been kind of overwhelming in a really wonderful way because of how expansive it is. In our current project, we actually have over 50,000 participants in our sample size, which is incredible. I've never collected anything close to that. So being able to work with such a massive data set with so many different opportunities for the directions that you can take, especially if you have multiple research interests, and then just how diverse the population is, that's not something that's pretty unprecedented when you're collecting your own research data. So those are kind of the things that are really striking about the All of Us data set.
Excellent. I want to ask the students. It's great to have some students who are learning research on the panel. I'm wondering, what has it been like to have All of Us as part of your education? Like, how do you think that has supported or hindered? I don't know. How has it interacted with your educational journey?
Hello, my name is Ehonaya Mijekanu. I'm an MPH student at Jackson State University. And how it has impacted my journey is after graduating from medical school, the reason I came was because I wanted to learn more about research. And at first, handling big data can be very overwhelming, but All of Us research is kind of easy for me to use because just immediately after building the cohort, it already gives you a form of descriptive analysis that you can even use to write an abstract. And, you can go ahead and even submit that, pending when you now decide to do the analysis using the Python. And it even drags the data straight to the Python or the SAS. And I feel like that is amazing, and it's a bit straightforward. And it has helped me. I submitted an abstract under the guidance of Dr. Bouillon. I was able to submit an abstract for APHA, and I even won the Graduate Student Award, using APHA. I'm using all of us research, which I also used to find out about the prevalence of obesity. So I feel like it's a very good way to start for students, in handling big data. Thank you.
Just to add on to what both of them, Dr. Smith said and you said, I collected about 260 participants in my sample that I recently did. Like Dr. Smith said, this gave us more than 50,000. So this was a wonderful opportunity to expand the research that I was already currently working on to get a whole population that I wasn't reaching, because I was just going online. So this captures so much diversity, so much different people. And like you were saying, that it's all within the system. I was using a lot of different statistical analysis programs that I was trying to juggle which one could help me out. Well, it's all in there, and it helps so much, especially for beginning students.
Excellent. Yeah. I was thinking about this when I was learning research, what it would have been like to have access to this kind of data just on hand. Would have saved many hours, I'm sure. So my next question is, the theme of this event is about moving from data to equity. We talked about how, data by itself doesn't lead to equity, but it can play a role depending on how you use it. So I'm wondering, in your experience, how do you think that researchers can use the All of Us database, or have used the All of Us database, to address long-running questions of systemic racism and inequity, or how have you been able to do a piece of that as well?
Well, hello everyone, this is Tiffany Hord-Aaron. I believe that a way that we can use this to address those systemic issues, I'm working with undergraduate students, and with all of the open access data and the data browsers, it allowed them the opportunity to see all of the things and how this data is collected, just even learning about genomic data at the broadest point of view, seeing why it's so important. And then to go on the back end of that, it has allowed us as minority researchers the opportunity to further add to the body of work from not just someone else's perspective about us, but through our own lens and our own perspective. So it has truly become an all of us encompassing program, because it's us also participating in the research about us.
Okay, so these events on our road tour tend to attract people who are curious about maybe using the All of Us database as a student, as a community organization, as a faculty. For someone who is just starting out and checking it out, like, what's your advice? What should they be thinking about? What should they have in mind? What questions should they be asking as they consider getting started?
Okay, well, I can take that. So if you're just starting and let's say you're a student and you don't know where to go, I think so one of the good things about All of Us is that they have office hours, so you can as well contact if you're confused about what to do. And it's also not so difficult. It's kind of a bit it's a bit straightforward. Like you just have to, like, if you watch the first introductory program, I'm sure you'll be able to build a cohort. So first you have a question in mind. Let's say you have a research question, and then you go out there. You can first of all, okay, fine, this is my question. So what kind of people am I looking out for? So if, let's say, for example, let's say you want to check on the prevalence of obesity. So you will know that, okay, that means I have to maybe I have to look at obesity. So how many people have obesity here? So you just maybe that will be your starting point. Then may say, is it morbid obesity, or is it pre-obesity, or overweight? So thereby you can now remove out your exclusion criteria, and also it's not so difficult. And then once you've actually done that, it's already going to give you a descriptive analysis of something, and you can actually move on from there. And then gradually. But the good thing about All of Us is that, they have hours that, office hours that you can always call. And recently, I remember the first speaker said something about they have like free tutorials that you can use. So I think that that's very helpful for students that are interested in, in research. Yeah.
Thank you.
Yeah, and to add on to that too, there are so many different resources available, even for faculty members that are learning new software programs, outside of just the courses that are available through the Researcher Academy. There are the research coaches who have open office hours. They also are really generous about meeting outside of those office hours as well. So there is a lot of support that's built into the system in and of itself, along with it being pretty straightforward to use. So there is like a humbleness of knowing that you don't have to know every single thing about how to work the data set when you are first starting. One of the things that I really like about the way that the system is built, and especially the data snapshot, the data browser, is that it does give you an opportunity to play around with and explore what data is there, so that you know pretty early on whether or not a research question that you have is going to be one that you actually can investigate within the data set, versus getting way too far into like costly, time-consuming research and finding out that, oh, well, this research question isn't actually going to pan out after all the way that I expect it to. So there's a lot that you can do on the front end before you really start digging into the project.
Yeah, pretty much my feedback is similar to the other panels. If you are unfamiliar with some kind of large data set in the secondary data analysis, but I don't think that much data anxiety for the people who are interested in this data set, because it's Dr. Smith said, there are good resources, coaches, that they're meeting, and then the course workshops, which were really helpful for me. The faculty are busy in the teaching, research, and the services, but if block the time weekly, and then digging the data set with the support from the academy, then you're gonna be successful.
Thank you. So if there's anyone in the room, I have more questions, but is there anyone in the room who has a question? So the question is, how much time did it really take compared to other experiences you've had to be able to use this data set?
I've worked on research projects that have taken years to be able to collect the amount of participants that you need in order to reach like the required N that has enough power for your statistical analyses. We set up our cohort like 2 months ago, and we're already looking at the analyses of it because the data is already built into the system. So you're just kind of working on the analysis of it. And the hardest part and the longest part is coming up with the research question that you want to explore.
Perfect, thank you. Anyone else jump in? Have a question? And so the question in the room is if anyone can speak to outcomes of using this data, who's on the panel. Could you put the mic right in front of you?
So outcomes, outcome on using the data, I wanted to find out the prevalence of obesity and how it relates to behavioral counseling, how many of them are able to partake in that, and also find out the differences between gender, age, and racial disparities too, using the all of us data. So, and what I found was it wasn't so difficult. I think it took me because it was a class research project, and so we just had like a week to do it, and I was able to come up with the results in less than a week, and even draft the abstracts and submit it. And so what I found there was that obesity was more prevalent in women and within middle age groups, and so it was a kind of interesting finding, and so it kind of made me started to think more, why is it more in women that are middle age group? Maybe is it because of childbirth, or could it be because of hormones, or why? So it was a kind of interesting finding, and that's something that all of us helped me do within a very short period of time.
Perfect. So before we move on to our final pieces, is there anything that you'd like to share with the audience that you haven't had a chance to share on the panel so far?
Well, I will just add, because I don't know what the next question is, it's a great opportunity, especially for junior level faculty, people just beginning on the campus. We often hear there aren't any opportunities for assistant instructor, assistant level faculty members. And this is a great opportunity to help you add to your resumes, your CVs, build your portfolios, especially when you're trying to build up to get to a tenure track position if that's your goal. They provide access for training that the university doesn't have to cover. So if you can find the conferences to attend, there's money there for that. So it just takes the burden off of the university, not only not having those avenues to help you, but the funds sometimes, because they're providing those things. So I think that it's definitely a great tool to have, and that anyone at the junior level should definitely look in becoming a part of the next cohort.
Perfect. Thank you all. Thank you to our panel for joining us today to share your experiences and for all the work that you're doing. Hopefully we'll get to learn of some of the outcomes as things continue. So if we want to bring, so I just wanted to take one moment, close to the end, but I just want to take one moment to recognize all of us researchers that have shared today, and those that weren't able to make it. There's quite a community, actually, of all of us researchers here at Jackson State and their colleagues at Coahoma Community College. Let's just give a big round of applause to everyone who's been able to share and everyone working on this important work. You all can go back to your seats if you would like. You don't have to stay up here. All right, so next we would like to hear, we're going to hear from Dr. Hood again, who's going to come on and share some of the upcoming opportunities for all of us from the Researcher Academy. There's another one of our tiny text slides. We'll fix that in post. All right, so Dr. Hood is going to join, and I will hand it to you to share what's coming up next.
Thank you so much, Paul, and thank you to our wonderful speakers today. Just before we hop off, I want to let everyone know about some upcoming opportunities to connect with the Researcher Academy. I mentioned the internship opportunity earlier. However, just want to announce it again that we are currently recruiting for our 2024 internship, which will start in June of 2024 here this summer. It is a 4-month internship opportunity that is available to both undergraduates as well as graduate students. A stipend will be provided for participation as long as the students are not currently being supported under another All of Us award. We have our eligibility is for students that are currently enrolled as a graduate or undergraduate student at an HBCU, and applications are due by 11:59 p.m. Eastern Time on this Friday, April 26th. And so there's just a few more days to apply, and you can scan this QR code for more information. Next slide. In addition to recruiting student participants for the internship, we do have an open call for individuals who could serve as mentors for the student interns. Once again, this would be a 4-month mentoring commitment throughout the duration of the internship, and the mentors will work in partnership with a co-mentor from our researcher workbench team, and mentors provide guidance and completion of the interns' projects. This is a compensated mentoring opportunity, and once again, the compensation can be provided if individuals are not currently supported by an All of Us award. The mentor application deadline is the same as the intern's deadline, and that is this Friday, April 26th by 11:59 p.m. Eastern Time. And you can scan the QR code here for more information, or contact us at our email address that's listed here on the slide. Next slide, please. I also want to make an announcement about some courses that we have that are going to be coming available soon. So in May and June, we have our Statistical Techniques and Machine Learning for Research Analysis course. This is an asynchronous course that will be available and led by one of our researcher workbench coaches, Miss Stephanie Tillman. And then we also have our Introduction to Literature Searching to Support All of Us data analysis course that will be taking place on May 21st. And this will be a live virtual course that is led by two of our library science staff at RTI who are also graduates of North Carolina Central University. We have our QR code here in the upper right corner, and you can scan that or go to the link there to register for the course. I will say for each course that you register for, you'll have to submit the form individually. Okay, next slide. Okay, and finally, I just want to invite individuals again to subscribe to our Connections newsletter. This is a great way to keep up to date on activities for the Researcher Academy, for some of our partners, as well as to stay up to date on all of the great accomplishments that our various different Researcher Academy participants are engaging in. And so we have our QR code here, and feel free to scan that or visit the link to sign up for our newsletter, as well as access all of our issues. Okay. And that concludes my announcements.
Thank you so much for that. Now, if you are not QR coded out, we have one more for you today. This is an important one. We want to hear from you all who've attended in person and online. So we have a short questionnaire about what you're taking away and your ideas for future road tours, which, just to give a little hint out there, are still being settled on dates, but are going to be in, we're looking to be in California and North Carolina. I have a question in the audience. You will, yes, and I'll share what we're going to send. So right now, I just encourage you, if you're in the room, use this QR code. Also, you should see the link in the chat if you're online to open that up and give us some feedback. And while you do that, I just want to close us out with a thank you to all of our presenters, all our panelists, all the folks here at Jackson State University who've just been amazing in helping us get this whole event planned and set up and getting all our tech down and getting our food. There's just so much going on. I want to give a special shout out to my colleagues, Angela and Danea, who are here with me in the room and have done so much to pull this event together, and all of the rest of my colleagues at Community Campus Partnerships for Health. We really believe in the value of this work, and it's an honor to be able to come in person and join you all. We will be sharing, for everyone who registered, we will be sharing, if you'll give us a minute to sort of deal with all the files and get things ready, we'll be sharing the slides. We'll also be sharing the video, which will be available for you and your colleagues online. If you want to visit back, we'll have it up on our YouTube account. And so you'll have further opportunities to look through, do the QR codes, get all these opportunities. And so be on the lookout, and we'll also be sharing with you some announcements for some of our future events. So thank you all again. Please fill out the form, and we really enjoyed connecting with all of you. Oh, and afterwards, if you want to stick around, if you are a presenter, researcher, we're going to get a group photo, so please stick around. Thank you all.